Welcome, Sanna. My name is Linio, and you've been in a program at Your Health Concept for a while now. Can you take me back to how things were before you started at Your Health Concept?
I actually started a comprehensive wellness program with Thomas because I was dealing with various persistent chronic symptoms after my breast cancer treatment. And so, to be honest, well, I'd already considered a wide variety of different options and also actually tested them out extensively with a number of different professional therapists in the alternative world, so to speak, but also in the medical world. I wasn't improving. I still had many symptoms. So I really had a major request for help from Thomas.
And how did those symptoms impact your daily life?
Well, almost completely. I've also been declared 100% disabled, so I can't work, and often still taking naps during the day. And I had trouble concentrating. Yeah, mainly it was chronic fatigue and concentration problems.
Those were the biggest complaints
Yes,
from before you came here?
yes.
Okay, and what all have you tried? What you just mentioned a bit, but can you tell me more? What had you tried before you came here?
Well, one of the very standard treatments that I actually underwent was because you've been treated for cancer, you get from the health insurance company a 3-month rehabilitation program offered. I did that. I had to do real rehab 3 times a week. And yeah, that helps a bit, but it doesn't address the core issue. So in the long run, it didn't really do much for me. I went to a gut therapist. But well, they do almost the opposite of what you do here. And also with another alternative therapist who really helps people after cancer to get back on their feet. And that didn't do very much for me either.
Those were only temporary solutions,
Yes, I suppose there were some genuine attempts at it, if we are being honest.
not even attempts. Okay,
I approached many therapists for help, but many weren't up for it because they actually have no experience working with cancer patients.
oh wow, geez. And what made you finally decide to take the step and make an appointment here?
Well, I'm also taking the training course. And during the class days, it became very clear where symptoms come from. I understood it a bit better. And then I thought, yeah, I just need to start a program first. And I had a lot of confidence based on the information I received during the training.
Okay, and then what were your expectations? You were already doing the training, so you had some idea. But what were your other expectations before starting a program for your symptoms?
Well, I had a lot of confidence. I suddenly thought, oh, I think I can actually be helped. And yes, that's true. This is also the case. Yes.
And what did the team do differently then? That made you feel heard here? That you thought that you gained trust in them? What did they do?
Yeah, I just got the knowledge about how the body works then. And yeah, that you're going to restore the biological clock and your mitochondria. And when you also understand why the body develops cancer, then you also know, oh yeah, this is what's wrong in the body and this is what you're going to address. So you just understand it better, and from that angle, so to speak, I've gained that trust.
Just seeing everything as a whole? Indeed. And what did you notice? What did you notice most during this process?
That I could really experience that my body was recovering. So first, after within 3 to 4 months, I experienced a lot of fatigue, even more fatigue, and that was yeah, the sign that my body was very clearly recovering. And eventually, my body really made that switch so that I slept better and that I had a bit more energy throughout the day. And yeah, I just started to feel a bit better in very small steps, but there was real progress in it.
Okay, so in the beginning it was very tough.
Correct.
And then I assume it was also difficult to think, I'm going to continue with this. When it gets very tough, then
Oh no.
no, you didn't have that?
No, I was very motivated. I was very strict, and I was always consistent with all the interventions.
That's good that there's so much trust, that you had so much trust in it. And are you symptom free now?
No, not quite yet. I've been, yeah, we started in July, so I've been at it for a few months. And yeah, I expect, and Thomas and I have also discussed this further, that I'll be at it for about a year and a half. I think even longer, because of course you also, cancer is a complex disease, and I've had many intense treatments for it. So I think I'll be busy with the recovery for a while. but I'm already noticing an upward trend. So I also expect that this upward trend will continue.
That's nice. What was it that you couldn't do before that you can do now? For example, you started in July. What couldn't you do before? And what can you do now?
Yeah, that I couldn't do multiple activities in a day, and now I can, or take longer walks. Yeah, I also had those concentration problems, and I still have that occasionally, of course. But in general, I have a longer attention span. Yeah, I sleep better. Mood is generally improving. Yeah, I can still say it's chronic, but it's much less of a presence now. And my quality of life has truly significantly improved.
That's nice. And what are the actual steps you're taking now to improve that?
Well, I'm very consistent with the morning light. If the weather allows it a bit, I'm also just outside a lot. I block out the blue light or the artificial light. I try to do a lot of grounding, and that's really my foundation, and it helps me a lot. So even if I've slept poorly, I still get up early to catch the morning light.
Yeah, and that naturally helps you feel better despite having slept poorly.
Yeah, I just know that I benefit from it a lot. So then I just keep going. I just keep doing it.
Yeah, just going into it with full self-confidence and confidence.
Yeah.
And which part has made the biggest change for you?
How did you say that?
What has made the biggest overall change for you?
In terms of the toolbox? I think the morning light, it's just a quiet little moment of the day that you can start for yourself for a moment. You're nicely outside in nature. Yeah, it's a good time of the day. So whatever happens, so to speak, that just continues. So that, yeah, it's a very nice start to the day.
How nice, just starting nice and quietly and then starting your day well. Yeah, sounds very nice indeed, compared to how people wake up nowadays. So what would you say to someone who is walking around with the same complaints as you?
That you can have confidence in your body again, even though you've been through something so intense. And that there is certainly, your body is capable of activating the self-healing capacity again, so to speak, even if you've had cancer and been treated for it. Yes, your body can indeed recover. Only you just have to take these steps for a moment. You have to do quite a lot yourself, but yeah, you can get that satisfaction out of it.
Yeah, and it's also nice that you say to just have confidence in yourself and in your body that it can.
Hmm.
What are you most grateful for?
That I have confidence in my body again.
That's what you're most grateful for, that you again.
Yes, because I've also had the fear that I would get breast cancer again. And my blood values also showed that my body had a lot of trouble keeping it clean, so that it could develop cancer all over again. And so with that request for help, I also came to Thomas. Like, I don't just want to get rid of my complaints and I want more quality of life again, but I also want to prevent or reduce the chance that I will get sick again. And I've gained much more confidence in that now. So I no longer live from fear that, but having the confidence that it will not happen again and that you just, yeah.
Yeah, how nice. Yeah, and how, but I do understand with that confidence that you have a lot of confidence comes into you. And you have the training too, so you have a bit more of an idea of how it's going to work. But someone who, for example, has no information about it, how would you try to tell that person like, hey, this really works, or this can really help you? So what would you say to that person?
Yeah, I find that a more difficult one because I don't hear any other experience stories about this. I haven't really spoken to Thomas about it yet. So I would then only speak from my own experience. And also keep my blood values in mind because they have also improved. And I find those very important in this. But yeah, speaking from my own experience, I have a lot of fellow patients who also had breast or, well, a form of cancer. And I don't know anyone who has so much confidence. So I'd really like to use my own experience to motivate those people, for example, that it is indeed possible.
Well, that's great. What a beautiful answer indeed. And would you recommend your health concept to others?
Definitely. Yes, absolutely. Especially fellow patients.
And why?
Well, to get that confidence back again.
Yes, of course. No, of course. Silly of me to ask. And what would you say to your former self now before you started this? If you could speak to your former self now?
Yeah, well, that you shouldn't think too long about whether to start such a program. It's an investment and it's an investment for life. So just do it Don't think about it. Just start the program.
Just do it. Yeah, that's beautiful indeed. And about that program with your symptoms, how would you describe it in one word?
Yeah, life-changing, I think,
Life changing.
if that's one word.
I can make it one word. Yeah, so now you feel more energetic, full, and things are much easier for you. Because can you still remember what was the hardest part about the period before?
Before I started the program,
The hardest part.
yeah, that I had to accept that I had very low energy. And to be honest, I didn't really expect that I could return to a company or, anything else related to my work. And also with social appointments, I had to cancel things very often. I was much more limited, and I always had to take my energy into account. And I don't have to, well, I still do it, it's in my system, but it has already improved enormously. So that's a big win.
And how do your loved ones around you, how do they see you differently than before? Do the people around you also see you differently than before?
Yes, definitely. But they also see me as someone who is really serious with all the tools from Thomas's toolbox. So they also see that I'm trying very hard, so to speak. So that's always the first thing I hear. Like, yeah, I don't know anyone who is so motivated to work on their health. And then subsequently, yeah, you also get to reap the rewards. So they do indeed see the difference. That I have a bit more energy and such.
And in your daily life, they also see that you're different and that you act differently, I assume, and that you're maybe around more often too, with social activities, for example. Yeah. And so have you also become a bit kinder to yourself compared to before? Or stricter, perhaps, because you're so serious?
Yeah, I think I've gained more respect for myself. I think that's it. Because I'm very consistent now. I know what I'm doing now. I understand what I'm doing. So yeah, I couldn't be more motivated to keep all of this up. So on one hand, it's kinder. On the other hand, it's a bit stricter.
Well, yeah. And how was it before you came here then? Was it always strict or just not kind?
Well, I was searching for what suited me best for my body and for my recovery. And I kept not finding the right thing. So then, yeah, I was constantly disappointed that something didn't work.
That must have been tough that you just didn't get the right help you needed every time.
Yes. And also that you then lose hope that there is something that will actually help you.
Yes. And what are you hoping that you can be able to accomplish and achieve for other people out there with this? Now, with the training and you're starting to become entirely and completely free of your symptoms. Yeah. How do you want to help others with this? Or how would you like to help others with this?
Yeah, I definitely want to help people from my own experience. And yeah, the knowledge I've gained, I'd really like to I utilize these methods to help people with numerous health related complaints that I encounter regularly in my own professional practice. But it doesn't really matter. It doesn't really matter what kind of complaints they are, so to speak. But yeah, I'd really like to restore to people the confidence that it is truly possible and that they can also be completely free of symptoms.
That it is possible and that it works.
Yes,
Okay, that's perfectly clear. Thank you, Sanna.
you're welcome.
Thank you.